My name's Erin Sweeney. I'm an occupational therapist, certified brain injury specialist, and assistive technology professional up at St. Mary's Hospital for Children in Bayside, Queens, New York. So in partnership with my regional rep, Alec, who has been a great partner in our practice, I started to see that there was so much more untapped potential for when our patients were outside of the program. So sometimes they're with us for 3-month stints. That's a standard episode of care, but then we're not seeing them for 10 and 12 months. And we're really trying to hone in on partnering with these families, but they're also full-time caregivers. They have full-time jobs and they have other children. And so it's hard to replicate what we do at home, but then how do we bridge the gap in care to maintain all of these gains? And that really comes from the RT300. The benefits of minimizing atrophy, improving the reciprocal activation of the agonist and antagonist muscles, reducing joint contractures, maintaining a supple range of motion. It really creates a lot more dynamic control for these patients to keep themselves in the best spot before they return back to care. So once I've started referring, I've now had patients use it throughout their gaps in care, and they're coming back to us even on their maintenance screens in a much better place than we would have seen them years ago. The RTI team just feels like family, and when you're working in such a small area of practice like myself, we're one of 2 sites in the country, we have a very small program, that level of community doesn't go unnoticed. And so for me, it only feels natural to partner with RTI because of that intimacy of communication and advocacy. So I feel like there's never too big of an ask. There's never a delay in communication. The team is always so incredibly responsive. The moment I send an email asking about, hey, do you think this kid would be a great referral source? It's immediate. Yep, let us know your clinical reasoning. Let us know how we can support you. Here are these forms. Here are next steps. And their communication with family goes unmatched. I mean, we wouldn't put a price on our own health, so why would we put a price on our patients' health? And especially for me, pediatric patients with spinal cord injury, this is a long-term journey. This is a chronic injury that affects them throughout their development. When we talk about the price factor, the investment is always going to be worth it long term because it's improving health outcomes throughout development and across the lifespan, which makes a world's difference for our patients.